Bioethics is one way of providing resources, of providing reflection, of providing, if you like, ammunition for people who are fighting in the trenches. So many people will be involved with the fight, but they also need information, evidence, arguments. The problems that we're having, the battles that we're having, they're also having in France. They're also having in Australia. So different countries are in slightly different places, but they all have the same battles. So much about bioethics is about recognizing our bodies, both the dignity of the body and the vulnerability of the body. And you might say also both the dignity of the mind and the vulnerability of the mind.
Professor David Jones is the Professor in Bioethics at St Mary's University, Twickenham, Clinical Professor at the Plunkett Centre for Ethics, Australian Catholic University, and a founder of the Augustine Bioethics Network. He's a corresponding member of the Pontifical Academy for Life, and from 2009 to 2024, he was Vice Chair of the Ministry of Defence Research Ethics Committee. From 2010 to 2025, he was Director of the Anscombe Bioethics Centre. And David joins me now. So, David, thank you very much for joining me on SPUCTV to talk about the Augustine Bioethics Network, ABN. And as I understand it, it's a network allowing individuals to voluntarily give their time and or financial resources to promote a vision of bioethics. And its aim is to create relationships, it's to connect people, it's to network people. What was your thinking behind an organisation that exists to connect other people?
Well, it was clear to me that bioethics was desperately needed. That we need to address the questions of ethics in relation to life, some of which very complex issues. And it also was clear to me that the same kind of questions are being asked in different countries and by different people. And we need to be able to connect people who are doing the same thing, but they're doing it in their own way or in their own countries, but also in a way which is sustainable. So the idea of a network which is a voluntary network is also, I hope, to make it sustainable over time, so that we're not reliant on, say, a single large donor, or we're not reliant on an organisation which is based in a particular place. It is really about connecting people who are already engaged, who already have things to give, and helping them to help one another, really.
So talk me through, if you like, the kind of nuts and bolts of this. Obviously, you do have a website. We'll give the address of the website at the end, or you can feel free to give it to us now. And there you'll have content accessible to anyone. Yeah. Beyond that, do you envisage, for example, a private space on the website where maybe other bioethicists or researchers can come and share material while it is in production, while ideas are being worked on before they become public?
So, as well as the website, we have a YouTube channel. So we will have videos, and are producing videos, and some of those will be related to events. So we will have events, and some of the events will be for the general public, and some of the events will be for members. So that will be one way in which we will connect members more particularly than just the general public. And also we have already started giving a regular digest, a monthly digest of information, which is again for members. So there's lots of information which is on the website, but there's some things which is not on the website. So we haven't thought as yet of having a separate space on the website as a place where members will exchange views, but we're certainly encouraging people to exchange views, and are developing different ways in which we engage specifically with members, as well as ways in which we engage with the general public.
Mm. So the name Augustine Bioethics Network is taken from the great Saint Augustine of Hippo. Why did you choose that particular person as your inspiration?
So Augustine of Hippo is the patron saint of philosophers. So he is perhaps the greatest of the church fathers, of the theologians of the early church. And he is really the inspiration of some of the great later thinkers, like St. Thomas Aquinas. A lot of it starts with Augustine, and he is both someone who engaged with the big public issues of the time, with the city, the world as a city, and so on. But also someone who is intensely personal, who wrote an autobiography and who talked about conscience. So he's both somebody who's very good to think about moral seriousness and conscience, but also about public engagement. And he also developed very much the church's teaching on the importance of the body, and human beings as a unity of body and soul, not simply as spiritual beings who are kind of trapped within a body. So much about bioethics is about recognizing our bodies, both the dignity of the body and the vulnerability of the body. And you might say also both the dignity of the mind and the vulnerability of the mind, which is something that Augustine also talked about. So there's a unity, but there's also and a dignity, but also a vulnerability. And Augustine gives all of these things.
In church terms, people would often refer to the ad intra and the ad extra. And you've highlighted some of the ways in which ABN will be different. But if we look at the ad extra, the outward facing aspect of your work, is that an area where you hope or imagine that ABN will be different, that it will not just be the theologians, the philosophers, the bioethicists talking to one another, but that you will produce work, you'll produce material that will be outward facing, that will be accessible, and you'll encourage people to come and engage with it?
Oh, very much so. I mean, really, the whole of my career for the last 20 years has been both working as an academic, working as a professor at St. Mary's University, and then working at the Augustine Bioethics Centre, but also engaging very much publicly, engaging with politicians, engaging with public bodies, and we very much wish the network to support public engagement so that these ethical questions can actually make a positive difference to the world in this country, but also in other countries. So to facilitate, because the problems that we're having, the battles that we're having, they're also having in France, they're also having in Australia. So different countries are in slightly different places, but they all have the same battles. And our aim is to engage, and we already are engaging, we already have engaged with the debate in different countries. And as I say, to help other people to do so, because it is all about a network. So it is all about people on the ground and helping to empower them by giving them information, but also by connecting them with other people who are fighting the same battles.
Now, if you were to ask the average person what is their understanding of bioethics, probably most people would struggle, and they wouldn't perhaps be clear about exactly what is involved in bioethics. If we take a step back and say to them, the debate we're having on assisted suicide at its core has bioethics. If we say that the recent comments by the Prime Minister on end-of-life care is foundationally about bioethics, and similarly the vote to decriminalise abortion in England and Wales in certain circumstances is a bioethics question. They might not in first instance have realised that. How do we make bioethics more mainstream, more understandable, just make people comfortable even using the word?
So bioethics is related to medical ethics, that's ethics for doctors, or healthcare ethics, ethics for the health service, but it's also about the ethics for, say, scientists in biomedicine who are dealing with these kind of issues. And in a different way, it's about the ethics for each of us, for all of us, in relation to our biology and our health, and to do with the beginning of life and contraception and abortion, or helping to nurture children, helping to create environments where we can support one another, mental health, physical health, to do with long-term disability, but also end-of-life care. And some of this is about healthcare ethics, but health is not just about healthcare. A lot of health is not just about healthcare. So it's about you could say it's about the ethics of health. But so the bio there is the bio of our biology, the flourishing of our biology, and the ethics is, well, doing it right or wrong.
Now, SPUC has been supportive of ABN and wishes it well and continues to endorse and support the work that you're starting now. So to take a tangible example, at the moment we are dealing with a second attempt to bring forward an assisted suicide bill at Westminster. It's effectively Kim Leadbeater Mark II. As an organisation like SPUC works to campaign against that, what could or what can ABN do now in the future to help or to support that sort of work?
So we are producing resources specifically in relation to this bill, and indeed, just this morning, I uploaded onto the website a new resource about the impact on care homes and hospices, and how one of the problems of this bill it's rotten at roots really, but it also has specific problems. And one of the specific problems is that there's no opt-out for care homes. There's no opt-out for hospices. There's no way for a hospice to stop a maverick doctor from giving people the means to end their life in the hospice, for having conversations in the communal areas, for asking people proactively who don't want to be asked.
Sorry to interrupt, David, but even if the hospice is governed by a religious ethos?
So the bill specifically says no one can be prevented from offering this. No one can have any detriment against them for offering this. So the bill doesn't just give conscientious objection for not doing it, it gives a kind of conscientious objection for doing it. This is completely novel. No other bill has done this. This is why it's not just a bad bill, it's a worse than usual bill. So this bill says, if somebody in your hospice or in your care home chooses to be proactively trying to promote this, leaving literature around, having conversations with people, upsetting people, there's nothing that you can do to them, because they can say, no, I have an individual right to do so. So if in a Catholic hospital somebody wanted to refer for abortion, the Catholic hospital could look at their regulations and say, no, this isn't allowed in this hospital, so you're not allowed to be part of this hospital anymore. If somebody wanted to do the same with assisted dying under this law, there's nothing the hospital could do. They couldn't say, no, you can't have residence rights anymore. They couldn't say, no, we sack you.
It's ironic, isn't it, that we've had a number of proposals, I think both in Westminster and at the Holyrood Parliament in Edinburgh, on the topic of conversion therapy. And the goal there is to prevent people having conversations. It's to stop them having a discussion about certain issues and about whether or not support or other alternatives could be given. And the motivation behind those sort of pieces of legislation is to shut down debate. And here we are having the exact opposite when it comes to assisted suicide or end of life. It's pushing it in to the conversation whether or not it's wanted.
Yes, absolutely. I mean, one of the good things about the law in England and Wales, law in England and Wales is slightly different from Scotland. In England and Wales, we have the Suicide Act, 1961, and the Suicide Act says not only that it's you can't assist suicide, but you can't encourage it. The law specifically says that encouraging someone, even if you don't do anything physically to help, encouraging somebody else to end their life is illegal in this country. So the new law, if it came in, would not only mean that you could assist people. It would also mean that you could encourage them, and you could say, in your state, surely you should think about this. So for those, most doctors would not do this. Most doctors wouldn't wish to be involved, but there will be some doctors who will think of this as the next best thing, as the sort of the panacea for all patients, and will push it, and will say to patients, no, you need to consider this, because this will end all your suffering. This is the solution to every disease. We can cure all your illness with just this pill. So the bill, this particular bill, is a very dangerous bill, and the network has on the website, I think, more than 20 documents already, which are in relation to assisted suicide and euthanasia, many of them which are specific about this bill. And I say the recent one just put up in the last 24 hours is about care homes, but there is also a question about how it affects suicide prevention, how it affects disability, how it affects the conscience of professionals. I mean, there are many aspects where this bill is dangerous.
Particularly coming back to the area of suicide prevention, another irony here, of course, is that in the case of online safety, all of our political parties, and certainly our government ministers, talk repeatedly about protecting young people online from, for example, any type of content that might encourage them to consider suicide or encourage them towards self-harm and suicide. And there would be a consensus that that is absolutely and completely wrong, and we must take whatever action is necessary to prevent it. The hypocrisy, of course, at the heart of this is that in a slightly different context, we're more than happy to allow people to be pushed or encouraged or persuaded towards suicide.
Yeah. So there was a case recently, a Canadian man, Kenneth Law, who sold a kind of suicide kit over the internet. Sold this lethal substance over the internet, and it affected hundreds of people, including many people in this country, dozens of young people in this country who took their lives using this man's lethal substance, and he's now been convicted in Canada of all places, where they have lots and lots of assistance in dying, and people can see there is something wrong with what he's doing. But giving a lethal substance by post to people who want it, who have asked for it, is effectively what this bill would do. There's nothing in this bill which prevents the remote access, the same sort of things that we've seen with abortion, the same sorts of things which have led to a huge increase in abortion, but also more questions about safety to doing things remotely. Exactly the same things being done for ending people's lives, because it will be more convenient, because it can be people can access it more easily, and because the harms, many of the harms are invisible. The coercion is invisible. So people will say, "Oh no, this is what we must do." So it is yes, it is a very dangerous bill. Actually, another irony is the bill is being debated on the 11th of September. The 10th of September is International Suicide Prevention Day.
Yeah.
So one of the things that the Augustine Bioethics Network will be doing is that we will be having an online event broadcast on the 10th of September about the relationship between assisted dying, so-called, and conventional suicide, and why this passing this legislation is very dangerous for vulnerable people.
Well, it sounds as if we could have Suicide Prevention Day immediately followed by Suicide Promotion Day.
Yes. Well, we dearly hope we could have Suicide Prevention Day followed by a second Suicide Prevention Day.
Ideally.
And that is what we want. And that's something that the ABN, that the Augustine Bioethics Network, also wishes in its own way to contribute to. This is something that lots of people are concerned about. Lots of people are contributing to. But bioethics is one way of providing resources, of providing reflection, of providing, if you like, ammunition for people who are fighting in the trenches. So many people will be involved with the fight, but they also need information, evidence, arguments.
As well as resources, which you mentioned, ABN has said that it hopes to be able to, among its goals, be of service to the Catholic community, to work ecumenically for the common good, and to engage in consultations. Can you maybe say a word about each of these, how you would see that going forward manifesting itself?
So the resources on the website are of three kinds. There are some resources which are produced by people who are members of the network. Then there are some resources which other people have produced, which we direct people to because we think they're quite useful. But thirdly, there are also magisterial documents. So it is also a place where people who are Catholics can find documents on abortion and euthanasia and conscience and other elements all in one place, so that if you looked up, say, euthanasia, you'd find some documents from members of the network, some documents from other organizations which we think are useful, and some documents which are magisterial documents, which are signaled as magisterial documents for the benefit of the church. So that's one way in which we hope to be a place that people can find specifically Catholic teaching if they're interested in it. On our board, we have an advisory board, and that includes people who are both Catholic and Christians of other denominations, and I have in the past, and I'm certainly interested in the future, in working both with people of other faiths and with people of goodwill who don't have a particular religious faith on these kind of issues. And interestingly, an issue like assisted suicide, like the present bill, is one that brings together people of different faiths, people without a faith, people with different concerns, some of whom are concerned, say, with domestic abuse, some who are concerned about eating disorders, some who are concerned about people with learning disabilities. They have their own concerns and they come for different reasons. And I hope that the ABN will help to network with people who are all engaging with human dignity, who all are concerned about these issues, but they're pulled in different ways.
Well, it sounds like it's becoming, and it will be, an absolutely wonderful and invaluable resource. For anyone who wants to access some of the material that the ABN is producing, you can follow the web address that's shown on screen now. And in the meantime, it only remains for me to say thank you, David, for joining me today and for the work you're doing, and we wish you every success with ABN.
And thank you. And a last word, can I say, and it is a membership organisation of volunteers. So do consider, there is a section on membership, do consider how you might wish to contribute if you think that this is a worthwhile thing to do.
Thank you and good luck.